Good afternoon to everybody. Thank you so much for joining us today. My name is Kimberly Randall, and I work with the Lister Hill Center for Health Policy, located inside the School of Public Health at UAB. Our center was founded in 1987, and we've made it our mission to connect and support those seeking to improve health outcomes through policy. Under the leadership of Dr. Suzanne Judd, we at the Lister Hill Center frequently publish policy briefs, testimonials, and policy resources, which reach thousands of people across the state. Our Health Policy Ambassadors program is a year-long fellowship that pairs multidisciplinary teams of UAB students with community partners to identify and address policy issues, empowering them to advocate for policy changes that will promote and protect public health. We support our partners in their own missions to improve health outcomes. In addition to these publications, we offer pilot grant funding for researchers looking to pursue research in these fields and offer a year-long slate of events, such as the one you're at today, to increase education, support, and community stakeholders in the UAB community at large. I want to give a special thank you to the co-sponsors of this event, the Office of Public Health Practice, and the Institute for Human Rights. This event is a part of National Public Health Week, an annual initiative of the American Public Health Association, which communities across the United States recognize the contributions of public health and highlight the issues that are important to improving our nation's health. As many of you know, Medicaid is a key component of the health infrastructure we have in the United States. The people in this room are researchers, educators, advocates, and students who see firsthand the impact of health resources, and I am honored to have you join me today to learn about how this impacts our home state of Alabama. Jane Adams is a 9th-generation Alabamian who lives in Huntsville. She earned her master's degree in theological studies from Wesley Theological Seminary in Washington, D.C., where she studied the ethical implications of public policy. She works as the Government Relations Director for the American Cancer Society Cancer Action Network, leading to the effort to expand Medicaid in Alabama. Jane previously worked at Alabama Arise, Bread for the World, the U.S. Department of Health and Human Services, Share Our Strength, Arkansas Hunger Relief, the United States House of Representatives Office of Vic Snyder, President Barack Obama's 2008 campaign, and the Alabama State House. She is the former co-chair of the Save for All Coalition, the largest anti-poverty coalition in the United States. She currently sits on the leadership team for the Southerners for Medicaid Expansion Coalition and is on the board of the Pulaski Institution. And she is, by her own words, the Ted Lasso of Medicaid expansion. Jane has a series of state and federal policy wins, including the passage of the 2022 Alabama Postpartum Medicaid Extension, the 2021 American Rescue Plan Act Medicaid Expansion Incentive, the passage of the First Step Act of 2019, and other policy wins such as summer EBT federal funding and implementation. It is my honor, and please join me in welcoming Jane Adams.
I wrote that, even I was impressed with it. Thank you. It sounds way cooler, but I'm just a nerd who is immensely curious about public policy and how it impacts everyday people who have to interact with it. I got my start in public policy when I worked with the Arkansas Hunger Relief Alliance, and I was tasked with essentially implementing a child nutrition program that didn't work, a federal child nutrition program. It was going to require children who were on free or reduced lunch in summer to physically go to a site to be fed, and that was supposed to be their nutritional supplementation when they were in school. And in Arkansas, much like in Alabama, there are some really rural places. And in fact, there were 3 counties in Arkansas that had 0 sidewalks. So when you talk about transportation and the ethics, the ethical impact on the human dignity of that child of having to physically go to a location to be fed, not only was it dehumanizing to kids, right, for them to have to venture out on their own, it was unsafe, and it was a bad public policy. If you want to end hunger, you don't fund organizations that then maybe feed kids if they physically come to you. You give parents money, which is what we did with the summer EBT program. When I started in Washington, D.C., we successfully, at Share Our Strength, got $50 million for a 10-state pilot program for summer EBT. And then, as the lobbyist that I am, I just started working my tail off on getting Republicans to see that this is smart public policy at the end of the day. It's not about politics. It's about what's actually effective in addressing the issue of child hunger. Just in December, that policy was made permanent, and so now every child in the United States who is free or reduced lunch gets an EBT card. Yeah, it's a big deal. Yeah. And that's what I'm talking about. But that's an example to me about how do we look at the ethical implications of public policy. I don't have a master's in public health, although I've strongly considered it, but I think those days are done. But I am a lifelong learner, and I'm just nerdy about public health data because I'm nerdy about human beings. Human beings, our bodies, are our physical entrance into the world. We are our bodies. I do have a seminary degree. I don't think there's this soul that just wanders, like Descartes says, around our body. Our bodies are our beings. We are not ourselves without our bodies. And so when I talk about health policy, or really any policy that is supposed to be an anti-poverty policy, it is a policy about bodies, about real people with real lived experiences that have real understandings of themselves in a narrative, a narrative with space, a narrative with others, a narrative with community, a narrative with family. And so when I'm going to talk to you today about Medicaid expansion in Alabama, I want you to just keep in mind the 220,000 real human beings who are low-income adults who have no access to health insurance right now. So if they're sick, their bodies, their personhood, their being is caught up in a system that is dehumanizing to them, that there are solutions for. So I just want to keep that in mind. But now it's time to get nerdy. So, as was mentioned, I work for the American Cancer Society Cancer Action Network. And so I have a cancer lens on this, but I'm not really going to focus on that today because the problem is so much bigger. I'm going to talk about closing the coverage gap, which is this crisis that is occurring in Alabama and 10 states across the United States. And I'm going to talk about it by kind of explaining where things are. I'm going to define the problem, determine the solution, and then this is the one I like. Once you determine the solution, you take that dream and you make it a reality. And then how do you know the outcomes in advance based on research that we know exists from 10 plus years of Medicaid expansion in 40 states. And then I'm going to take some questions for you because I am a lifelong learner and I just want to know what you're thinking about and kind of nerd out a little bit. Okay, so this shouldn't be news to you, but I talk with lawmakers in Montgomery every Tuesday through Thursday, so this is just like practical 101 for me, is explaining the difference between Medicare and Medicaid. Medicare, right here, Medicaid aid for people, that's the best way I can explain it. Medicare and Medicaid are vastly different programs, and they're not even vastly different programs. Medicare is one program. It's an entitlement. You turn 65, you're entitled to Medicare. Congratulations, no matter where you live, what zip code you're in, you get Medicare. However, there are 50 Medicaid programs in the United States, and there's a reason for this, and it's racism. And I'll get to that in just a second, but spoiler alert, it's racism. But there are 50 Medicaid programs, and that's because Medicaid isn't an entitlement. There are very few people entitled to Medicaid. Medicaid is a state and federal partnership program where the state determines the policies, and then the funding is jointly shared between the state and the federal government. And it's at certain percentages in certain states. So in Alabama, the federal government currently pays around 73% of the cost of Medicaid in Alabama, and then the state picks up the rest of that share. But the state gets to determine what their Medicaid program looks like. So we'll get to that in a little bit about what Alabama's Medicaid program looks like right now. But let me touch on structural racism in Medicaid. Medicaid started during the Civil Rights era, a time when the Voting Rights Act was just passed. And there was a lot of pushback by southern states to federalize programs, right? They wanted to make Medicaid federalized like Medicare was. That no matter where you live, what your zip code was, if you met certain qualifications, you were eligible for Medicaid. They wanted to make it like Medicare. But the design of a state-run Medicaid program was part of a compromise, essentially with Southern Democrats at that time. They didn't want to have a federalized Medicaid program. They did not want poor adults folks that were just being defined with disabilities, really not even the ADA was there yet, but they did want poor adults to have this entitlement to health care, to the thing that makes you who you are and fixes your body. So as a part of the compromise in southern states, so they can continue to control the health care of their low-income populations, which is no surprise if you look at the history of where it was going on, that it's built on these racist roots. The reason why we have 50 Medicaid programs and not one Medicaid program is inherently structural racism. So state control of healthcare for the poor, when the state is controlling, especially a state that has harbored institutional racism, it is controlling the bodies. It controls the destiny and outcome of individuals that are low income. But then, the Patient Protection and Affordable Care Act passed, and that had a provision in it, along with many other wonderful provisions, and like shouts to the ACA, but it had a provision in it that would have mandated Medicaid expansion to essentially ensure that every state had Medicaid expansion, and that all low-income adults would be covered up from 0 to 138% of the federal poverty level. It was one of the key pillars of that three-legged stool. Does anyone remember the ACA three-legged stool? Anybody? Okay. It has, the individual mandate was one, that one's gone. And then there was another, patient protections, right? So no pre-existing conditions, lifetime caps, you can't, those types of things, protections that were there was another stool. And then Medicaid expansion and subsidized health insurance was this third stool, right? So we want to ensure patients are protected. We want to ensure that we can, incentivize people through a tax on them to get health insurance, and then we want to make sure that health insurance is affordable. And they did that in two ways: Medicaid expansion, the other part was subsidized health insurance plans on the marketplace. A combination of state, federal government, health insurance, and private health insurance. However, the Supreme Court struck down that provision. They struck it down for that very first reason. That inherent thing that makes Medicaid such a problem, which is Medicaid is a state program. There are 50 different Medicaids, not one, so you cannot force any state to expand Medicaid because they control the eligibility rules in that. And that's why the Supreme Court struck down federal Medicaid expansion and left it up to the states. And ever since then, states have been expanding Medicaid. Republican states like Montana and Wyoming and Utah, not Wyoming, Republican states like Montana and Utah and Arkansas and of course California, New York and the rest, Louisiana, Kentucky, Virginia, the newest one, North Carolina, which just expanded Medicaid last week. So now we're down to there's only 10 states that have failed to expand Medicaid. They continue to opt out of this, of Medicaid expansion. So here's just a little bit about Alabama's Medicaid, that one state of the 50 states. Alabama Medicaid is a health insurance program that provides comprehensive and affordable health care coverage to people with low incomes, with an asterisk, like a big one, a big asterisk. Beside that, Medicaid, Alabama Medicaid provides essential health services to low-income people with disabilities, older adults, children, families, and pregnant women. So you look in that and you see, okay, you gotta be blind, have a disability, and low income. With that, you can't just be blind and rich or disabled and rich, you gotta be low income. You gotta be an older adult, so, and not just any older adult, you gotta be an older adult that's in a nursing home, and then you get joint Medicare, Medicaid, and children, so all kids, which is one of the best things we have in the state, is our all kids program, children, families, and that only means the parents who have the income eligibility if their children is already on Medicaid. So it can't just be like any family. You need a certain income qualification of 18% of the federal poverty level, and pregnant women, and now postpartum women for 12 months. But that's it. You're missing adult. There's no just clear low-income adult. Medicaid currently covers 1.1 million Alabamians. It covers a lot of people. The vast majority of those are children. However, we need to define the problem. And part of the problem is that we're in a healthcare crisis because that adult population is missing. because we have not included them in the coverage of Medicaid. We have left them in a gap. We're in a healthcare crisis because low-income workers and adults have no access to affordable health care in Alabama. Hospital and compensated care record highs. 15 hospitals are at risk of closure just this year. We're in a very frightening doctor shortage that is only getting worse, and in pretty much every single industry within practice within doctors. There's another thing that, if you leave that adult population out, what it leads to. We have a financially devastating Alabama Department of Corrections hospitalization spending problem. So right now, because we failed to expand Medicaid, the state has to cover hospitalization costs, the full cost. The federal government doesn't help out at all. The state has to cover the full cost of whenever an inmate in Alabama is hospitalized. And I don't know if you pay attention, but we got a lot of people in our prisons and a lot of older folks and people who are sick. So every year we spend close to $100 million just out of our own taxpayer dollars, with no federal match, to just pay for hospitalization costs of inmates. And that spending is getting worse and worse and worse and worse and worse as the prison population ages and ages and ages and ages. And then we have this other problem, which is the Medicaid unwinding. We've been under the public health emergency for the last 3 years, but no longer. We are done with public health emergency. And that means that the protections that have been there for people who are on Medicaid are going away. And Medicaid can start disenrolling folks. So the people that have relied on Medicaid and have had it for 3 years, maybe they got it when they were pregnant back in 2020, and now have a 3-year-old. And they've been able to stay on Medicaid that entire time, are going to lose their health insurance. In fact, we think it'll impact upwards of 61,000 Alabamians who be kicked off of their coverage. And if a parent gets kicked off of a coverage, then that means there's lots of uncertainty of whether the child will also have coverage as well. But there are some things that the state does well. Alabama Medicaid does well. All Kids program. We're an early adopter of All Kids, the CHIC program, Children's Health Insurance Program in the United States. Early adopter of that. It is a very broad, liberal income range where it impacts not only low-income children having access to care, but also moderately to middle-class income children also having access to free health care. All Kids is seen, taken by a lot of pediatricians, and most of the pediatricians, it's a good program that's running, and doctors will take All Kids, and there's a huge population that's in it. We have the Nurse Family Partnership Program, which is launching and is our current Medicaid commissioner's kind of favorite program. I shouldn't say that. I shouldn't put words in her mouth. It's a program she really likes, and I think it's really smart because what it does is it partners with vulnerable parents when they are pregnant, teenage pregnancies, pregnancies of folks in mental health crisis or substance use disorders, partners to put a nurse in the home, to be in the home with the child for the first 1,000 days of that child, first 2 years. And that's really great, but imagine if we could include the moms in that instead of just the care of the child, right? The Nurse Family Partnership Program, the governor and the Medicaid commissioner want to make it in every county, which would be very, very great for things like infant mortality and maternal mortality. We extended postpartum Medicaid, so now parents who have children don't lose their health insurance, their Medicaid health insurance after 60 days. They can have it for a year. We have Medicaid dental now. That's like, hey, dental benefits. That's a really important thing. So those are some good things our state does well. But we've got this massive coverage gap. And I really wish I could they did show me how to use the pointer, but I don't remember. But can you see that crazy number in the bottom left side? At $4,475 per year. So if you're a parent or a caretaker, your kids, you're a family of 3, right? So 2 adults, 1 child. You can't make more in Alabama to qualify for Medicaid if you're that adult, that parent or caretaker. Because no low income without children, there's nothing. You can make $0 a year if you don't have a kid. You're not going to qualify for Medicaid, right? It can only be for parents. If you make more than $4,475 per year, you are ineligible for Medicaid in Alabama. It's 18% of the federal poverty level. The only other state that has a more more aggressively cruel Medicaid eligibility rate is Texas at 12% of the federal poverty level. So it's 18% of the federal poverty level. If you make $5,000 a year, sorry, you can't qualify for Medicaid. And that's a family of 3. And then you can't begin to get subsidized health insurance on the marketplace until you make around $27,000 per year. And so there are about 220,000 low-income working parents, low-wage workers, veterans, college students, older adults that are in that health insurance coverage gap, in the coverage gap. 220,000. Let me talk about that number for a minute. If you lined up shoulder to shoulder, 220,000 people, and I want to do it correctly, so I got the average, looked up the average width of a shoulder, and then, you know, if you line 220,000 people up, it's 77 miles of people. Imagine that, driving 77 miles. Just like, close your eyes, you're in a car, you're driving 77 miles of people lined up, shoulder to shoulder, that have no health insurance in the state. Low-income workers. Low-income workers who are changing sheets at hotels right now, that are working at McDonald's down the road, that are serving at a gas station, that might be doing childcare, a stay-at-home parent, a massage therapist, a hairdresser, a mechanic, someone who's a plumber, hospitality services, somebody working in sales at TJ Maxx right now. Those are the worker target. Chick-fil-A. Think of all of the workers you interact with. Those are the folks we're talking about that are in the gap. And I want to introduce you to one worker. And it's my good friend Jesse. His name's Jesse Odman, and I just feel like he can share his story a little bit better than I can.
People in Montgomery like to say that we go on Medicaid, we either quit our jobs and sit at home. But I lost my job because I didn't have it. In 2021, I was working 60 to 70 hours a week. My wife was taking care of Jack, our youngest, when I got sick, and we didn't have insurance. It was the first time I'd ever been let go of because of my health. And I got very emotional because I didn't know what I was going after that. I've always worked. And we had made enough already in the year where if we're trying to get Medicaid, we couldn't. But at the same time, being a cook, we weren't making enough to get private health insurance. The whole time I was sick, my main goal was to get back to work. But everything pretty much came crumbling down. All because I got sick. My health matters. And I feel like there should be more resources for people like me who are on that edge and fall into that gap. Expanding Medicaid in Alabama is the right thing to do because it would change the lives of people like me.
So that's my friend Jesse Odman. I met Jesse in a pharmacy. I was going late at night. It was Star Market Pharmacy in Huntsville. I was going there late at night and, you know, pick up medication for myself, or maybe my daughter who has all sorts of ear infections from daycare viruses. And I was waiting in line, and I saw Jesse standing there, and he was wearing a cool Pantera t-shirt, you know, like a hard rocker. And I noticed it, and I noticed him, and I overheard him say to the pharmacist, or the assistant that was there, that he didn't have health insurance. And I looked at him, and he had wrapped his legs, he had wraps all around his legs, and his legs were swollen from so much water retention. He had edema. I mean, I didn't know that he had edema, but I could just kind of guess that it was edema, right? And Jesse lost his job because he'd been standing up as a cook for 20 years, right? And hadn't had health insurance for the last 15, right? And so every day, the chronic physical toll on his body, his personhood, his being that he did to provide for his family, every single day it was compounding with this chronic health crisis. And here he was just getting like simple diuretic medication, but he could not afford it. It was $220. And so I paid for Jesse's medicine, just right then and there. And I said, I'm gonna journey with you, Jesse, and we're best buddies now, and our kids are friends. And all it took was 3 months of me helping Jesse go to the doctor and paying for that, paying for Jesse's prescriptions, making sure he's gets a liver scan to make sure his liver is fine. Just 3 months of journey with Jesse, and he was able to get back to work full time. His health got way better, right? Like, I mean, obviously he wasn't struggling with water retention. He lost something like 50 pounds of water weight over that period. His wife was able to get back to work because she didn't have to take care of him at home, because before he was able to get care, he was bedbound, right? Couldn't take care of his 6-year-old son, Jack. Both of them went back to work, and within months they qualified for a federally subsidized health insurance plan. So now Jesse has a nice Blue Cross Blue Shield Silver plan with a $0 premium and $0 deductible. And he's getting mental health treatment for PTSD, and he started taking smoking cessation medication to help quit smoking. And Jesse is going to the doctor regularly and likes his doctor, who ironically is an Iraqi woman, and he served in Iraq in the military. So it's this really beautiful story of Jesse. And that's the difference healthcare makes, even for a short period of time in Jesse's life. Now, if his wife keeps losing hours, like she is, because she works in a hotel, as a receptionist, and keeps chronically losing hours there as things shift in employment in hotels. If she loses hours, then Jesse will go back into that next year and wouldn't qualify for health insurance. And again, wouldn't have access to medication. So closing the coverage gap will provide quality, affordable health insurance to 220,000 low-income adults in Alabama. This year, roughly 30,000 Alabamians will be diagnosed with cancer. Just this year. And access to affordable comprehensive care is essential to detecting cancer early, treating it, and surviving the disease. The burden of cancer is heavy. And it's made even more so when you do not have insurance coverage. It's devastating, financially devastating. In fact, it's so financially devastating, not just cancer, but chronic health conditions in Alabama, that 1 in 5 Alabamians have medical debt in collections. It is one of the largest forms of debt that we carry right now. It's preventing people from improving their credit scores, purchasing a home, moving on with their life. Medical debt is a sentence, essentially, to poverty, something you cannot escape. You may, your hospital or health system may write off this or write off that, or let you pay this much off there, but once it goes into collections, that's on your credit score. And there's no amount of alleviating it later by the kindness of a stranger that is going to take that credit score thing away. Research shows that living without health coverage means you're more likely than those with health insurance to be diagnosed with cancer at a later stage. There are thousands of Alabama women who are going to get cervical cancer screenings, but it's way too late. They're going to the emergency room because they're in all sorts of pain, right? And they haven't had a pap smear in years, and a very preventable, treatable cervical cancer diagnosis is becoming stage 4 and the sentence to death of them. So, determining the solution. There are 50 Medicaid programs in the state, which means there are 50 Medicaid expansion programs in the state. So if Alabama decided to close the coverage gap, it could look any way that it wanted to, essentially. It's just up to our lawmakers to determine what that looks like. And really, not even lawmakers, it's up to the governor, because she has the sole authority to expand Medicaid in Alabama. Lawmakers don't even have to vote on it. But here are some rules that I always encourage the governor's office and lawmakers when I meet with them, and advocates from Blue Cross and the Hospital Association and others. This is the expertise I bring when I come to do strategy conversations with them about what closing the coverage gap will look like and what it should look like. My opinion is that policy to close the Medicaid coverage gap should center those who are in it. Their lived experiences, their real lives. It should be easy for them to access care. Right? So that means that it's not enough if you get a Medicaid card and you expand if your doctors are taking Medicaid. That's a problem, right? It's not all right if you're getting a Medicaid card and you aren't being educated and being made aware of primary healthcare and family healthcare services if you're just going to the ER, which was your practice to do in the past, right? There are policies that need to center those who are in it and their real lived experience. It's unacceptable to put a work requirement on a non-work program. Medicaid is not a work program, it is a health program. Work requirements are just bureaucracy for low-income people. Because for 2% unemployment, 70% of those who are in the coverage gap are working, and 7% are caretakers. So it's just millions of dollars of red tape to essentially bar some people from getting Medicaid. And it's illegal, and I will fight hell if they ever try to put a work requirement in, although I can't fucking people. But we need to center lived experience. That's what ethical public policy is. It goes back to those kids, right, in Arkansas. You have to center people like Jesse. So who's in the gap? Let's talk about it. I mentioned food service. The vast majority of those who are in the coverage gap are food service, right? They're working at fast foods, they're cooks, they're restaurant servers, right? Ask your bartender. When you go to a restaurant tonight or sometime later today, think about it. Think about that server. They're cashiers in sales, travel agents, carpenters, day laborers, housekeepers, janitors, landscapers, hotel desk clerks, office clerks, butchers, laundry workers, 14,000 of them in Alabama. This is Alabama, right? Bus drivers, taxi drivers, parking attendants, barbers, child care workers, personal care aides. In fact, there were recent stories about some Birmingham hairstylists and barbers who are in the coverage gap. These are people that you sit in their chair and they talk to you to make you feel better, but they don't have health insurance and they're standing up all day long and have arthritis because they're cutting hair all day. Somebody comes to install an AC, God forbid, your AC goes out this summer. They come to install it, chances are that person doesn't have health insurance and is in the coverage gap. Determining the solution again, closing the coverage gap. This is really important. And there's one thing I need you to take away from this, is this. There is one person. One. This is an audience of one. There is one person in Alabama that can solve this problem. And that's Governor Kay Ivey. She can unilaterally expand Medicaid on her own. The legislature would have to fund the budget, it would have to go through a tiny small committee, but today she could tell her Medicaid commissioner to submit a state plan amendment to extend Medicaid, to expand Medicaid services to 138% of the federal poverty level, and that would start the process today. There's nothing the legislature could do about it because it's her authority to do it. In other states, they have stripped that authority away. After the Affordable Care Act, when Obamacare was and Medicaid expansion was sent back to the states, a lot of states reacted and said, we're not letting our governors expand Medicaid, right? And so they put on all of these provisions that they've been not able to do that. Well, not Alabama. Alabama doesn't have those. The Governor Ivey still has the authority, and she's the only one that does. So my job is every day to meet with Alabama lawmakers and staff for the governor and educate them on the coverage gap. They know I'm coming. We're very friendly. And I love talking with them, and I love sharing Jesse's story because I like for them to see real people, right? Just real folks. And believe it or not, some of them are curious, and then some of them just have talking points that are like 15 years old and very out of date. And I just work every day to try to finagle them and mold them and shape them and get them to see that this is such a huge financial benefit. And everyone has excuses. There's all sorts of excuses, but sometimes you, and this is another thing I want you to take away in your work, and I'm sure some of you have experienced this. I'm a firm believer that sometimes you have to will something into existence. And every day I wake up and I will mention it like with my whole being. It's like a meditative practice of we will expand Medicaid in Alabama. We will expand Medicaid in Alabama. This year, we will expand Medicaid in Alabama. And it's always in my thoughts and in my running. It's a passion, right? It's a lived thing for me that I feel this deep desire. And I feel it because it will cut poverty in half in our state. Cut poverty in half in our state. Will cut the uninsured rate in half. This one simple policy that 40 states have done, that we have 10 years of research, that states like the liberal bastion of Montana has done. It will cut poverty in half. I must will it into existence. And when I meet with Blue Cross and I meet with the Hospital Association, I bring that and I go, we must expand Medicaid. We must do it. And they're working on something that might work. But hope goes a long way. If you're in Montgomery, it's like where hope dies. And I just have to choose to believe every time that I'm there, that when I'm talking with lawmakers, that if I'm genuinely bringing facts and I'm genuinely bringing curiosity, I'm just curious what you think about healthcare in Alabama. You know, like, a curiosity, a sense of wonderment to them, a passion, a desire, making them see just how interconnected health is and why it's so important for humans to have health care. So what does that look like? A little bit. It looks like I'm constantly, anytime I've been given an excuse, I just, instead of saying, oh, that's an excuse, I go find fact. Or I chase it down and I make that excuse go away. So for years, Governor Ivey said, the reason we can't expand Medicaid is we can't afford it. So in 2021, Southerners for Medicaid expansion lobbied the United States Congress to put in an additional financial incentive for our states to expand Medicaid. Essentially, the governor told me, how am I going to afford this? And I said, bet. And I went to Washington, D.C., and we met with a bunch of lawmakers, and we got making Medicaid expansion even more affordable. So if the state expanded, it would be budget neutral. We wouldn't have to spend a dime more in general fund spending. We wouldn't have to take any money from the Education Trust Fund. In fact, we would save upwards of $400 million a year. And the additional revenue that would come in from the federal government increasing its share in the matching of this spending is $2 billion every year. $2 billion. And then you think of the additional revenue that comes in. Medicaid expansion is budget neutral. It is not something that will harm the budget. It's not something that causes proration or any of this stuff. It's worked well in all the states where it's been implemented. People won't work. That's not true. People are already working. So again, 70% of those in the gap are working. This is Obamacare. Well, conservative voters support Medicaid expansion again and again and again. In every single state that we've seen it. And this is really not Obamacare, this is like ARPA care. It's like it's a completely new concept, and the federal government is allowing for completely new things. And really, every state gets to decide what it looks like. It wasn't Obama. Every Medicaid agency gets to decide what they do about Medicaid expansion. So what would be the outcomes? I already know what the outcomes would be, because there's 10 years of research and tons of scholarly articles looking at Medicaid expansion programs in states that have expanded. What we know, or what we suspect, based on the evidence in other states like Arkansas and Kentucky and Louisiana, Utah, we see that the uninsured rate gets about cut in half in states that expand Medicaid. So Alabama's uninsured rate would be cut in half. It would create 20,000 new jobs, and that's because it's a total investment in the healthcare industry. It's not just an investment in hospitals, it's an investment in rural physicians, pharmacists, that's jobs, right? That's your Walgreens that's gonna pop up, right? And then the Walgreens is gonna pop up and the Subway's gonna pop up next door to Redlands County, right? And that's what it is. It's a total it totally stimulates the economy in every county in Alabama, because there are people in every county in Alabama, bodies that need health care. So it's a total investment with 20,000 new jobs. It'll make our hospitals more financially sound. We're in real trouble here. Like, I could be coming to you in a couple of months, and you might be seeing it on the news about a few hospitals that are going to close in rural areas. If we don't do something soon, especially with the Medicaid unwinding happening, we're in a lot of trouble. Early detection and treatment. My goodness. Imagine what this will do for cancer rates, heart disease, diabetes, lung conditions, Alzheimer's. I mean, imagine what it'll do when people can have early detection, when they don't have to wait till they're 65 years old to get health insurance and go see the doctor, when they can get care when they're 50 or 51 or 58. Reduction in debt and poverty. Again, 1 in 5 Alabamians have medical debt and collections. Medical debt and healthcare expenses are moving more people into poverty in the United States than anything else. Anything else. So it is the biggest driver of people moving into poverty is medical expenses. And the dignity to be well. Imagine just the dignity to be well. So with that, the dignity to be well, I hope I briefly just kind of explained to you why I love Medicaid expansion so much. I would love to answer any questions you have about my work in Montgomery or Medicaid expansion or really anything else you have questions about.
So I'm going to go ahead and get us started. For accessibility purposes, we're going to use a microphone. So if you guys want to raise your hand, I'll come to you for that. But Jane, one of the things that the Listener Health Center has worked on this year is the topic of civic engagement. So you have 70 odd people in this room right now.
Yeah.
What's something that all 70 of us can be doing to help?
Call your lawmaker. No, I'm serious. They won't pick up the phone though, so email them. email their assistant. I'm sorry, they won't, unless you have their cell number, and then they might, but it's better to text. No, call the governor's office. Last year we had 600 people just in one day call the Bella was part of that campaign. 600 people in one day call the governor's office. And I can't tell you, that kind of stuff gets back to her, you know, it really does. If the assistants are like, hello, all day long, they keep track of that stuff. And so sometimes it's powerful, like have this action-based advocacy. Save the governor's number, Google it, look it up, Governor Ivy's switchboard, save it in your phone, and whenever you see somebody is a restaurant server who is coughing, or somebody who's working at a gas station who clearly looks like they have the flu, just give her a call. I call all the time. Talk to your lawmakers. ACS can, like I have my information, I think I have it in here somewhere. Yeah, here it is. That's my email, it's j.adams@cancer.org. That's my cell phone number. Please call me, text me, seriously. I mean, it's fine. Text me or call me. If you run into someone who's low income who needs health care, I can help navigate that. But if this is something that like you are really curious about too, and you think, man, this really intersects with the work that I'm doing, or could really, I want to be part of this, of figuring out how my job and my passion does, how it can be a part of this, which will drastically change our health system in Alabama. Like I just talked with, we're gonna figure out a way to get some researchers to come down and testify, some public health researchers. There are Republicans in the legislature who support Medicaid expansion. It's not as controversial of an issue. The governor is our only real holdout. I have at least a dozen House members in the Alabama House that are Republicans that support Medicaid expansion, or what they will say, closing the coverage gap. They still won't say Medicaid expansion, but whatever. Closing the coverage gap, they can call it whatever. Closing, because it's their own program. Closing the coverage gap. Yeah, and then about 7 or so senators, again, Blue Cross is working on a proposal. Things are coming out really soon. We need your voice. We need you to talk to your lawmakers. We need you to call the governor. Op-eds, you can email me. I have like a ton of staff that just help people write op-eds and get them placed. And that is such an important thing to do. In fact, if you've seen probably any op-ed about Medicaid expansion, like my fingertips are somewhere in that. But it's a passionate way for you to explain how this intersects with what you're doing and why you care about it. It's not lobbying. I just want to say that because there's no bill. There's no bill for Medicaid expansion. But we don't have to vote on anything. So it's not lobbying for you to meet with lawmakers and talk about why, from your professional expertise, this is something that they should be looking at and considering from a public health perspective. That's it. Yeah, hi.
Thank you.
Yes, thank you, Jean.
So, I have a simple brain, and I would love for you to explain something to me.
Okay, please.
Conservative lawmakers
Yeah.
in this and other states, and let's just give them a party label, Republicans,
Yeah, sure.
including our governor,
Yeah.
often tout themselves to be pro-business.
Yes, yeah.
Medicaid expansion will be the one thing more than anything else that can save these rural hospitals.
100%.
When a rural hospital closes, the county closes.
That's right, it's
You
largest.
lose your largest employer, probably most of the professionals that are in the community.
Yep.
Why can't lawmakers support keeping hospitals open?
Well, I think because it's been a long time since one's closed, but that's not going to be much longer. COVID kind of helped prop up failing rural hospitals. The last one we saw was Pickens County, I believe, and that was in 2020. It was the very beginning of COVID when Pickens County closed. So it's been a while, and they don't remember. They barely remember COVID right now. I'm serious. They're passing. Well, I can't speak about what kind of laws they're passing, but they barely remember COVID, and they barely remember the last time a rural hospital was closed. But that time is coming soon. So it is just a memory issue. But I think giving them the dire facts about that and confronting them, we're constantly trying to find stories of people who were employed at those hospitals and what happened to them. If you know people that were employed at hospital or health clinics or anything that had to close because of uncompensated care costs, because that's like a real huge, big problem. Yeah, the pro-business side of it. So there is a coalition of health. It's a healthcare consumer coalition. Business healthcare consumer coalition that has Blue Cross Blue Shield, in Alabama Power, major, the Business Council of Alabama, big regions that does support access to healthcare for all Alabamians. So this is an issue now that businesses are taking up, chambers are taking up, economic developers are talking more and more about. And that's certainly an angle. And if that's an angle you want to contribute to, I can get you in touch with their people, because I don't really focus on the business side, even though I know it's significant, right? It's a significant draw, and those are jobs, and that's tax income that goes into our ETF, which means better schools for everybody, supposedly. I think on our Ivy, it's hard to tell like what it really is. I think if you're basing things off of her responses, she remains open to the idea of expanding Medicaid. I think she wants an Alabama solution, right? Which I'm like, great, because Arkansas was an Arkansas solution. There are 50 Medicaid programs. Whatever you do is an Alabama solution, and you have a lot of say over what is to be done, right, on this. You can make it look a way that you want, and I know that she's engaging in conversations with business leaders and Blue Cross and the hospitals right now about possibly ways that an Alabama solution would work. But so I think things are changing, but there were years when Bella and I were working on just trying to get one business to talk out. But I think now the dynamic the conversation is changing quite a bit. But it's this momentum and pressure. And I really do think like we have directly impacted people that talk about it. We have physicians that talk about the coverage gap. And then we have some businesses. We're beginning to recruit law enforcement to talk about the coverage gap because it's significant. Sheriff associations in North Carolina and other states have expanded. They publicly supported expansion, and we want to get our Sheriff's Association to do that too. But I'm in a room full of wonderful public health minds. My thing is yeah, we've got to get business involved, and she's got to see that angle. But for some of the lawmakers, them hearing it from you, I mean, to some degree, I know it was crazy during COVID, but to some degree, some people did listen to the experts. People that used to not listen to the experts for a while, they did. And I still think that there are some of those that are at the State House where expert witness, expert testimony, conversations from you all will go a long way in adding to this conversation. I hope that answered your question. Yeah, okay. Yeah, hi.
I have two questions.
Okay.
When you were a student, is there anything that you did to help you get to where you are, such as being an avid reader on the topic, listening to podcasts, or talking to people? And two, did you have any mentors that pushed you along the way and helped you get to where you are?
That's a wonderful question. I love talking to students. Because I feel like I'm still one somewhere. When I was in college, I went to a tiny conservative Christian college because I was such a bad high school student that I couldn't get in college. I skipped out almost my junior year. And it's because I was bored, like that's really what it was. I was bored, so bored. And, so I barely could get into college. And I went to a tiny little college in the middle of nowhere, Arkansas, where I had to go to Bible class every day. It was wild. And curfew. It was my mom's dream. It was in a dry county. It was just great, No, I studied history, but I studied, I was just really curious about who was left out. I was always curious about where the left out people, and I'm not Jewish, but in the Jewish tradition, I did go to seminary, so I studied a little bit, but in the Jewish tradition, there's this understanding of the midrash, which is the gap in the narrative. When they look at the Torah and they open up the scriptural text, they read the stories, but they're constantly thinking about who is being mentioned, named, but not speaking. Like, what is that story behind that person? Where's the story within the story? And I think when I was in school and was kind of exposed to educate, to classes that made me curious, like I would say holding on to curiosity was like something that I really had figured out through undergraduate and then work, right? I started working in government and politics when I was 19. I was on the Obama campaign, paid Obama staffer when I was 19. I worked in the U.S. Congress. I dropped out of college for a year and worked for a congressman. So I did do like normal, went to seminary. I mean, it's like not your normal path, but it's because I've always been immensely curious about humans and what their stories are. and how their stories interact with the complexity of the public life, right? The public square, the public circle, you know? And mentors, I have a lot of mentors. One of my biggest mentors is Sister Simone Campbell. I don't know if any of you are familiar with Sister Simone Campbell. Sister Simone Campbell is the lady who led the nuns on the bus. If you have ever heard of the nuns on the bus, she's a Catholic she's a Catholic sister, Roman Catholic sister. This year, President Biden awarded her with the Presidential Medal of Freedom because of her work with the poor. And when the Affordable Care Act was being debated in Congress, there were a lot of conservative Catholic Democrats who wanted to oppose the Affordable Care Act because of provisions around birth control. So the U.S. Conference of Catholic Bishops, so like the big old guys, they opposed portions of the Affordable Care Act, and it looked like it was going to die, right? Just because of birth control, right? And contraception. And Sister Simone led a letter signed by 46,000 American nuns, U.S. nuns, Catholic sisters, supporting the Affordable Care Act because of Medicaid expansion. And that convinced 7 Catholic Democrats to switch their vote and vote yes. And she effectively saved the Affordable Care Act. And that's why she was given the Presidential Medal of Freedom. And she's a very close friend of mine. And she just centers me, reminds me of my mission and my calling and what I'm supposed to be doing. And this just need for helping the poor, and not in a way that is paternalistic, but just journeying alongside of people, no matter what their income is. And I can be best friends with Jesse, and even though, we have a lot in common, except for I just happen to have generational wealth. He doesn't, that's the only difference. So, that would be my advice, just curiosity, being really vigilant and curious. Thanks. Good luck. Hi. I love your sweater.
Thanks.
Yeah.
Dress.
Oh, it's even better. Okay, good. Yeah.
Question, in one of your slides, you had talked about the Alabama Department of Corrections.
Yes.
How the state is paying 100% for inmate care.
Yes.
So with this new jail that they're building in Belmore, and you also mentioned that there's a shortage of doctors.
Yes.
Which are, I'm sure they're gonna have a medical facility for this 40,000.
They will have a clinic.
Yeah.
But they will have what is federally mandated for them to have, which is not adequate. Healthcare, especially if you have an aging and sick and overcrowded prison population. The prison will already be overcrowded by the time it's built. I think based on the projections that we've seen. Again, I don't work on this policy, nor does my organization have a position in this Q&A. What we do know is that with an older and sicker and aging prison population, with longer and longer sentences where people are not getting out in reasonable amounts of time, that is an immense cost on healthcare that continues to skyrocket. And if we expanded Medicaid, it wouldn't cover the care in the facilities, right? So the state would still have to cover that, right? And they usually do that through prison healthcare contracts, which they're in the process of negotiating one now. But when somebody leaves the facility and goes to a hospital, they are no longer in that prison anymore. They're in a hospital that has to meet federal qualifications. And right now, because we have not expanded Medicaid, they are uninsured, technically, when they go to that hospital to receive care, or when they go get dialysis, for instance, they are uninsured when they go there, and the state is having to pick up 100% of the cost. However, if we expanded Medicaid, those incarcerated individuals who would go to the hospital, say they had a heart attack or something, stroke, go to the hospital, as soon as they enter into the hospital, they are eligible for Medicaid expansion. And they can get emergency Medicaid, essentially to cover, and the federal government would cover that at 90%. So instead of paying 100% for hospitalization, which we're currently doing, we would only pay 10% and save roughly $70 million every year that we could then use on whatever we wanted in APC. It's not a savings as in a cut, it's a savings as in what do you want to do with $70 million to help the prison system?
Yeah, do you not think that with when this hospital, when this jail is built, that the governor would see the benefits of expanding Medicare?
No. I doubt she'd want to tie together something something that she's not thrilled about and something that's kind of a policy blunder. I would not, which is the prison policy. But I think what's going to inspire her is when hospitals start closing. I think that it's going to be doctors packing up their bags and leaving. It's going to be patients who are in that hospital checking out in cabs to go to UAB. They'll all come here probably. So you'll all see them all. I think that's what it'll be. I doubt she'll see it, but I understand where you're going on that logic. And it's a massive problem. I work close with Alvin and Appleseed on some of those questions around ADOC funding and Medicaid expansion, because I think there are a lot of lawmakers that of course, would want to cut ADOC funding. They think there's been too much, but they don't, of course, want to reduce the prison population. So it's a real crisis. So, yeah.